Good afternoon, everyone. Welcome, welcome, welcome. Thank you for being here in the room. It's a nice, cozy space, and thank you for joining us online. I'm really delighted today to introduce Dr. Ken Thompson, who is a public service psychiatrist from Pittsburgh. Ken graduated from Kenyon College and Boston University School of Medicine, where he was a National Health Service Corps Scholar. He was a resident in psychiatry at Albert Einstein College of Medicine and did his postdoc in mental health services research at Yale. He's been on faculty at Yale.
My post, here's my postdoc.
And the biggest claim to fame is that he was Phil Leaf's postdoc.
That's true.
And so he's been on faculty at Yale and University of Pittsburgh. He was the director for medical affairs at the Center for Mental Health Services at SAMHSA in the U.S. Department of Health and Human Services. We actually overlapped in our federal government service. And he was the PI of a Robert Wood Johnson Foundation grant linking Pittsburgh and Glasgow, Scotland, in pursuit of achieving health equity and resilience in left-behind communities. He's the chief medical officer of the Pennsylvania Psychiatric Leadership Council, which is a policy and advocacy organization. He's a Soros Physician Advocate Fellow, and he is the founder of Visible Hands Collaborative, a nonprofit organized to import integrative community therapy, ICT, and solidarity care from Brazil. And we are going to hear about that and hopefully about many other things in the time that we have with Dr. Ken Thompson. Over to you.
All right. Thank you, Dr. Collins. Thank you, Pamela. I am absolutely thrilled to be talking to all of you and to all of you. A little bit about ICT, Integrative Community Therapy, and maybe a little bit about public health and psychiatry and mental health as a sort of a backdrop to that. The talk is entitled Revolutionized Care, Solidarity, Dialogue, and Integrated Community Therapy. And the concept here is that communities have the capacity to generate problems for themselves and to heal them. And it's the emphasis on the heal them part that we're going to try to talk about today. So I'm very honored to be here to be able to discuss this. I'm going to talk basically about, well, I'm going to tell a couple stories, but let me see if I can. We have a very sensitive knob here, and if I can get it to do the right thing, it'll go to the next thing. There we go. You know, they always ask for disclosures, and I never have any, but then I think that feels so empty. Like, what are you, just a shadow? I mean, so I do have a disclosure. I'm actually really passionate about this stuff, and you may hear that in what I talk about. Let's see if we can get it to go. Another one. Want to try it? So much better. So I said I was going to tell a couple stories, and what I want to do is talk. Overall, I'm going to describe what integrative community therapy is. And to do that, I think you have to locate it in its history, what the story is. And then I'm going to talk a little bit about the practice of ICT and then reflect on this concept of solidarity care and mutual aid and its uses in particularly in the Anglophone world, but it doesn't have to be just the Anglophone world. Let's go to the next thing. I'm going to try it. I'll try it. Oh, too far. There we go. Okay. First, we're going to talk about Brazil in just a minute, but I want to talk about how I came to ICT in the first place. And that actually, interestingly enough, Phil, I think it might have been towards the very end of my time at Yale that I started to hear about a psychiatrist in Brazil who was doing large group community sessions of some kind. And I had zero idea about what that was. And it was just I think just a hint. I have no idea where I heard this, but I knew that something was going on in this idea of a large group in which a psychiatrist ran it. That turns out not to be actually accurate of what was going on, but it is a little bit of a piece. So I'd had this thing in the back of my mind. And part of the reason I'm going to talk about this story in particular is to just talk about how to take advantage of serendipity or synchronicity. So in 2017 or so, I ended up, I was at a conference in the UK, and there were a bunch of Brazilians there. And I asked them if they had ever heard, this thing had been sticking in my head for obviously many years. I asked them, have you ever heard of a doc who is running large groups? And they all said, oh, yes, that's a very real thing. It's going on in Brazil. It's all over the place. And I said, well, that's interesting. That's cool. And then I promptly kind of shoved it away, right? Until um, my daughter, who decided to become a psychiatrist, married a guy who was a Brazilianist. He's a political scientist who specifically studies Brazil. And so I said to Alice when COVID came, and her classes were canceled, and we were looking at like everybody's all stuck in their houses and stuff. I said, maybe this thing can be done online. Maybe we could figure out what this is about. And we tried to find the connection to the people in Brazil and couldn't do it. I couldn't do it. I could not figure out where they were, what they were doing until my daughter Alice managed to get to the very, very bottom of the internet and found a group of expatriates from the United States who were running an IT session online from Geneva, Switzerland. So we hooked up with those folks, who then hooked us up with Adalberto Barreto, who's the founder of ICT, the guy who put it together with the community that he was working in, which we'll talk about in a second. And as a result of those connections and that option, we were able to actually start ICT. I neglected to mention that Alice was hoping to actually go meet the guy in Brazil. She had travel plans with her husband who was needed to do some work in Brazil to finish his PhD. They were all set to go in March 15th, 2020.
Yeah, we did.
So anyhow, that's all just to say, if you ever have something delivered to you like this, there's connections that you can take advantage of and they keep popping up. My suggestion is do it. Okay, that's my small professional advice. So to get back to ICT, ICT was created because basically of the problem of migration in Brazil. In Brazil, as you probably are aware, they're cutting down the forests, and when that happens, the land becomes desertified. It stops being able to support life, and you have just massive amounts of the interior of Brazil where people were living who just can no longer live there anymore. And this actually started back in the 60s and 70s and into the 80s. And they go into areas that are famous in Brazil known as favelas, basically large shanty towns, the kind of thing that you can see in many other parts of the world that are still economically challenged. So this particular shanty town, let's see if I can do it. There we go. On the northeast coast of Brazil, there's a city called Fortaleza, and there is a huge favela called Pirambu that's basically surrounds all of Fortaleza. Fortaleza is on the coast, and it surrounds it. So little bits of the shanty town are on the beach itself, as you can see there. Anyhow, it houses more than 1 million people. It's basically just cardboard shacks, at least initially in the 70s and 80s. And the story is, let's see, oh no. The story is that one of these towns, one of the parts of the favela, kept getting knocked down by the police. They would come in and they just knock every single structure down and, beat the people. And a human rights lawyer from Fortaleza, got involved with the community and went to it and spent some time there and found, as you might expect, that this large number of migrants from the interior who'd been displaced have come in. They have no real resources. They're disconnected from any kind of municipal services. The army's coming and beating them up all the time. This is, by the way, during the dictatorship. There was a dictatorship in Brazil until 1984. And what happens is that the lawyer has a brother who happens to be Adalberto Barreto, who's up there on the picture. And he says to his brother, would you please help me address the psychiatric problems that are going on here? There's violence, substance use, depression, so just the whole litany, and trauma, obviously. So he says, "Will you come help us?" And Alberto says, "Well, yeah, you can tell them to come to my office, and we'll take care of people there." And what happened was that his office in the center of town was a bus ride away, at least, from the favela, and nobody came. Nobody showed up. So Alberto, who had had some training, had an inkling to be a priest, and had just jettisoned that and decided to become a psychiatrist, and some training in cultural anthropology, spent some time in France. He decided that he was going to go to the people, right? So he took a couple of medical students with him. And this is the apocryphal story that he goes to the favela. It's actually a particular part of the favela, and called Quattrobara. He goes to the favela, and he gets there, and there's, as I said, there are no buildings in the favela. It's just the only shade there is a tree, if there's a tree around. And he gets there, and there are 100 people lined up to see him in the sun. And he says, "Okay." And he asks the first person in line, it happened to be a woman. He says, "How can I help you?" And she says, "I can't sleep. I can't sleep." And he says, "Well, I've got medicines that I could give you that might help you sleep." And she says, "Don't bother. I don't have enough money to feed my kids. I can't do that." And then Alberto says, "I saw the 99 people behind her, and I thought, what kind of a day is this going to be? How am I going to get through this?" And as he's talking to her, he realizes that the man behind her had started to rub her neck. And another person in the line had come and gotten her a chair. And actually another person came and washed her feet, right? They did this whole sort of enactment of caring for her in front of him. And he realized, as the story goes, that his capacity to help folks with the tools that he has as a psychiatrist were very minimal. And what he thought and realized was that maybe what he could do is to help organize this obvious capacity of the community to care for each other and to see some way to structure that. And that's what started to happen. Now, two things about that story that are of note. One is that it is an actual story. It did happen in somewhat like this. The woman who couldn't sleep because her husband had been murdered 3 weeks beforehand. So that was another element to the story. And the second thing is, remember I told you I heard this story way back? I had actually heard that the chief thing that the community had complained about was that they couldn't sleep. So I think I had heard some version of this original story way back when. Anyhow, at that point, Alberto says, "Okay, we got to try to figure out what we can do to help this community." And that's the process that began the search for what eventually became ICT. All right, let's go on here. So what has emerged with ICT is it is a large group dialogic process. So people are talking and listening to each other. And its goal is to help people problem solve with their emotions and develop solidarity, connections within the community, and increase emotional literacy so people can talk more about how they feel and what they're experiencing. And it is now, all across Latin America and spreading into other parts of the world. What I want to heighten, just to say in terms of its roots, its fundamental roots are in the work of Paulo Freire. Are folks familiar with Paulo Freire? Paulo Freire is a teacher from Brazil who in the 1970s, 1980s, he published a book called Pedagogy of the Oppressed. And his work actually is sort of the basis of adult education today. And the idea is that people who are adults are much better at learning when they are focused on an immediate challenge that they exist in their lives and when they work together in that connection. So essentially, ICT, integrative community therapy, is an application of Freirean thought to dealing with emotional challenges. That if I can get you that idea, that's the biggest frame for it. There are some other elements which are really important. Indigenous wisdom. So Brazil is a pastiche of all kinds of people, right? Especially the favelas. So there's an African influence, there's indigenous influences, there's European. They're all jammed together, and in particular, the indigenous roots are very strong around the notion of a healing circle and connecting with each other through getting together as a community. So this is not something that's unfamiliar to the culture. But then there's other aspects of it. Uh, uh, what's his name? Bateson. And sort of communications theory, how you talk with each other, in what way you could have a communication that allows everybody to be able to express themselves, are all parts and pieces of the process. Okay, let's see. Okay, so I've mentioned already that it's kind of spread around the world. I said it was a large group. When I talk about a large group, the Brazilians have run groups of several hundred people participating in this. The usual group is somewhere around 50, 30 to 50, and it occurs in a community setting. It is not considered, it's not thought of as being, as we would call it, HIPAA compliant. It is absolutely an open meeting for people to come attend. You can do it in HIPAA compliant ways. The method itself can be done, but in terms of its initial original purpose or process, it would be done in a church courtyard, right? And you would get people to circle up and talk with each other. And as I've said, it's now spread around the world. In Brazil, for reasons which I'll talk about later, it is part of the National Health Service. So community health workers are trained in ICT and do it as part of their work. So it is something that is done, and it's done usually in some kind of connection with primary health services, with the idea that if the primary health physician or practitioner finds somebody with emotional challenges, that they have a place to refer them to, which is go to the ICT that meets every Tuesday at 12 o'clock in the churchyard. That's kind of the way that it runs itself. This is what it looks like. Okay. And I mentioned that we started in COVID because we couldn't obviously get together in settings like that. We started doing it on Zoom, online, and it actually works. It's a process that can work online. The Brazilians have a couple of sayings that inform the way they approach this. The first is that when the mouth is silent, the body speaks. So there's a lot of challenges around people having a wide range of bodily complaints, and the thought is that if people can express some of the challenges that they're facing emotionally, that some of those bodily complaints will decrease. And when the mouth talks, the body heals. So that's a frame that the Brazilians carry into this. They also carry, and how they got to Muhammad Ali, I'm not quite sure, and how Muhammad Ali got to this particular statement, but it's an extremely wise statement. Not surprising given it was Muhammad Ali. It isn't the mountains ahead that to climb that wear you down. It's the pebble inside your shoe. So ICT is geared towards addressing not the huge, earth-shaking, terrible secret that you have in your life. It's more about the average day-to-day challenges that we run into in life. So problems at work, problems with our families, problems with our partners, kind of life stuff that happens, and that happens to everybody. So it is not focused on any diagnostic group. It's really sort of a general overall approach to populations that are living under stress in some form or other, to allow them to be able to talk about those stresses with each other and share their pebbles. I think it matters where I have this, no? Yeah. Okay. So as I said, it's a large group. The process of organizing this group, community health workers do this in communities in Brazil. There is an understanding and an expectation that people get together. This is probably the biggest challenge that we have in the United States, is getting people to feel comfortable being in a room like this. And to be honest with you, if I didn't have to describe what this work was all about at some level, because you guys are an academic group, I would have said the thing to do was to just run an ICT here, and you could have all experienced what this is like. But there are a couple of very straightforward rules, and this is why an element of this that's important to keep in mind is that it is not set up to be done by professionals. It is set up to be done by peers from a community. So community health workers or anybody in a community who gets themselves trained and has the capacity to organize a group to participate. So the training we can talk about a little later, but the rules are pretty simple. They are that you only speak about yourself. There's no like telling somebody else what to do or how to do it. You're not there to share anything other than your own experience. So it's built on this idea that our participation in a group isn't about what we are telling other people to do. It is about sharing what it is that we have ourselves. So no advice, no judgments, etc. In a big group, not everybody gets to talk. And actually, the most important thing is for people to listen. That's actually what makes the biggest difference. And the Brazilians, it's a culture that's very musical. It's a culture that's very focused on food. And in between each phase, which I'll show you in a minute, they break the process to stand up and move around a little bit. They have dynamics, so they'll do some exercising just to re-emphasize that our bodies are with us all the time. You don't get too lost in your brain. And also, at any time, if you have something that you would like to contribute, a poem, some bit of writing, a piece of art that you have available to show, you are able to bring that into the group. Okay, so when you speak for yourself, one of the ways you can speak for yourself is to use a cultural artifact. So what does a process look like? Is everything clear so far? Anybody have any? The groups are run in the following way. They're essentially 5 steps. First one is welcoming, and we want to make sure that everybody feels that great. It's great to see everybody. We want to thank you for coming and participating, and then talk a little bit about what the ground rules are that I've already kind of outlined for you. One rule that I should emphasize that I didn't mention, I kind of hinted at it before, it's not HIPAA compliant. So we say to people, you're not here to disclose the deepest, darkest secrets in your life. Anything that you would be worried about other people talking about you or saying about you or knowing about you, you are not expected to disclose. So we are not here to do anything that is going to shatter your reputation or ask you to participate in it. So after those kinds of rules are given out, the next step is to go go through a process within the group of figuring out what particular issue is going to be talked about in the group. So what's done is people in the group are asked, is there anyone here who has an emotional challenge, something that's happening that's distressing you, causing you not to be able to sleep, or causing you discomfort or challenges in your day-to-day life? Do you have a pebble in your life right now? And would you be willing to share it with the group? And we say to the group that one of the things that's a tremendous gift for the group is for anybody to share one of their pebbles, because that allows the group to do some work together. Okay. So we ask people to share and give people a little bit of time to sort that through, and then say, okay, we'd like to gather maybe 2, 3, 4 pebbles, depending on the size of the group. I should mention the groups usually run 90 minutes, 75 to 90 minutes. In the United States, we've had to adjust that a little bit because people want to go faster. So they want an hour. That's kind of where that comes with troubles. And it turns out people usually like to hang around a little bit longer because they say an hour, but Americans, we don't really mean that. We want to pretend like we're that busy. Where was I? Oh, we're picking the pebble, right? And what we'll do is we'll ask, and I don't expect anybody in this room to say what pebble they have, but if I had said to you, is there a pebble in your life right now that you could potentially talk about? Would you have one? Yeah, okay. So we always find people with pebbles. There's always people with pebbles, and people are willing usually to talk about it. We'll collect those pebbles, and as each person presents their pebble, it could be something like, I'm very distressed. My grandmother died last week, and I really miss her, and I don't know how my life is going to organize itself and how I'm going to live with her gone. Not everybody just had their grandmother die last week, right? So you can't use a pebble that's very specific. You have to use a pebble that has some generalizability. In that case, it might be, has anybody else in this room lost a big important part of their life? And that what you would say to the person who's presented that pebble is, you've lost something that's very important in your life. And when we talk about what this pebble is, it's going to be about the subject of loss and how you've managed to deal with that and what the distress is. You do that with 3 or 4 other people, and at the end you have essentially a bunch of themes that can be discussed. And what you say to the group is, we have these 4 themes or 3 themes. We're now going to choose which of the themes as a group we're going to discuss today. So you don't talk about all 3, you just try to talk about one. And you say to the people who presented their challenge, whose theme is not picked, is, we're not here to choose people, we were just choosing the theme. And the theme is based on what the group as a whole feels is important. So it's the way to bring the group into some alignment as a group. And the group then, I'll encourage you to come back next week or whenever the next meeting is and raise the theme again. And, hopefully it will be chosen at a later date, right? So it's a bit of a challenge. It's been really hard, especially for Americans who feel like if they're not chosen, they've somehow done something wrong. But if we choose everybody, then it takes more than an hour. So we're kind of built our own little challenge there. And the focus, I think, of just one theme has been really critical. And yeah, so everybody then decides as a group, we vote on which theme we're going to pick. And then the person whose theme is chosen, we say to the group, okay, is there any more information about this problem, this challenge that this person has, that you would like to learn from the person who's got the problem? Are there any details or issues? Not to try to solve the problem. And this is where it becomes, interestingly, much easier for people who are not mental health professionals to deal with it, because mental health professionals immediately go into a mode of, I'm going to solve your problem, and turn the whole thing into a process of solving the individual's problem, which is not really what this is about. It is about helping the person, but it's not about solving their problem. Okay. So the group chooses a theme, and they ask some questions about the particular areas. Can you tell us a little bit about your grandmother and what she meant to you, and what were the things that you're now worried you're going to be missing in your life? Some more information about that. Um, and you try to find a way to ask a question that might help them think differently. Like, if they're really morose about having lost somebody, do they imagine a future in which they might not have to feel so terrible about the loss? Is there any way that they could see a life in not right now, but sometime in the future, that would allow them to live and feel differently than they do at this terrible moment? Those kinds of questions, something to just help them open up a little bit from where they are. And then we say, okay, sit back. And now what we want to do is ask the rest of the group, have you ever experienced anything like this yourself? And the critical question is, what have you done to overcome it or to deal with it? And then everybody in the group, usually we have to tell people we can't continue because everybody wants to contribute. Everybody in the group talks about an experience that they've had within the context of that theme and how they've managed those particular emotional challenges. At the end of that, we ask people, okay, we've had this conversation. You've been able to hear from people. Is there anything, to the person who presented the pebble, is there anything you've heard that you would like to particularly, recognize or comment on? And then the person has the opportunity to say anything if they want to. And then to the rest of the group, you've all had the opportunity to participate in this, and you've heard various things from folks in the group. Is there anything that you've heard from this group that you would like to express your appreciation for hearing? I should emphasize the idea of appreciation runs through this. When I mentioned the welcoming, one of the things that we do as a standard exercise in welcoming people is to ask people, is there anything that's happened in the last period of time that you want to let people know about, that you appreciate, or that you want to celebrate? So we've set a context for allowing people to have some sense to say things about stuff that is good. We want people to be able to talk from a frame of good things that they've had happen, in addition to the pain and suffering that they've had. So then at the end, in Brazil, people stand up after they've expressed their appreciations, and they do a large group hug. And they actually have a song about how you swing together, and even though you're swinging back and forth because you're being held up, nobody falls down. And it's really quite beautiful. In the United States, not so easy to do anything. It can be really a challenge. So that's the way ICT sort of runs.
That's a good question.
Yeah.
So is it every single week this is going on in the community and people come and go as they are interested in, but it's in the Brazil, in like places where it exists?
Yes.
Like it's the first Tuesday of the week we have this, and,
yes.
and whoever shows up and that.
So that's the way it's sort of set up in the connection with the primary health services. In addition to that, they do them sporadically.
Sure.
So if and they particularly do it. I've mentioned a sort of open meeting where people come in and they present their pebbles. You can also do an ICT around a particular community theme. So if there's been an incidence of violence in the community, or there's some particular community issue that's really driving people crazy, meetings can be called around that. And they're done in all kinds of environments. So I've talked about sort of the village, right? They're done in schools, they're being done in universities, they're being done in jail, they're being done in workplaces. So they've really kind of expanded it to wherever people are in a place where they can get together. How often they do them on all those different settings, I'm not entirely clear myself, to be honest with you. But I think in general, I have now run into, and you can check this out yourselves if you know any Brazilians. I run into Brazilians and I say, do you know anything about ICT? And they go, oh yeah, I participated in one. So it seems to be relatively spread around in the communities, at least my experience so far. Yeah.
Yeah, you had mentioned that it's kind of embedded in the National Health Service.
Yep.
I was curious to know, like, how long is the training? Because the facilitator role probably seems like a really important role
Yes.
where everything is going smoothly. So I'm curious, like, how long that training, if you know. I mean,
Yeah, no, I know. I do know. I do know. And I can so and you picked up on the right word. They're not leaders, they're not the professional group leader like we would expect in most groups. They are facilitators and they participate in the group as members as much as they participate as facilitators. So they could respond to somebody's pebble by saying, I had that same experience. And so it's a little bit of a fuzzy role, which takes some training to get used to. We do trainings now of about 60 hours of didactic sort of talking about, how to get people to participate, how to get people to talk about their challenges, understand the rhythm and the frame that I've just been going through. And then the really important part of training, because we want people to start doing this right away, is that there's ongoing supervision for people, so that they come and talk about what happened when they facilitated a group and have somebody to talk about the challenges. When a group is finished, we ask people to say to the group, some of you may have had issues that you did not present, or the issues that you did present, you wanted to present but didn't present, are pressing issues. And we ask that you, at the end of the group, come let us know about it, and we will make sure that we refer you to the resources that can help you address those challenges. So we don't want people to be in a place where they'd have no place to go. And that actually is why the Brazilian National Health Service decided to fund this, was that they found that, and these results here, there's tremendous amount of research. I would say, a lot of it is sort of somewhat qualitative, some quantitative stuff, nothing quite like if we had been able to unleash NIMH on this. But the Portuguese, it's mostly in Portuguese. The Brazilians have done a fair amount of work on documenting sort of outcomes that occur both at the group level and at the individual level. One of the key ones that got them to be able to get the health service to pay for it was that they found that people who participated in this were much less likely to go on to request professional services. And when they're so overwhelmed with need for professional services, anything that helps people go off and not need professional services and results in them having a somewhat better outcome has been valued by the Brazilian National Health Service. So that's
are you willing to take one question online?
yes, sure.
One in the chat. Yeah. Letitia, do you want to ask your question?
Um, sure. You said that you have these rules, and one of them is you can't fix it. There is no fixing the problem. I've been in circles like this, and after a little while, when the pebble keeps coming up consistently, there becomes a let's fix this. This is something we can fix. How do you prevent that from happening?
So let me maybe just say it one more time, because I'm not sure that I've got it.
So, like, to give an example, let's say the example you gave there were, these vandals were coming in, beating people up, tearing down their homes, whatnot, and that's why this became an issue. So how do you prevent it from being? How do we prevent that from happening again? Because that is what's causing all of these people to have this pebble. How do you prevent that from happening?
Yes. Okay. So So that was actually the army that was coming in and knocking down all the buildings. The solution to that ended up being not just the activities of what happened in the favela, but across the country. They managed to start a democratic movement that got rid of the dictatorship. At the level of the community, though, these smaller communities, what has happened has been that when something keeps coming up and they find that it has a root in something that's an issue for the community, what's happened is that the community then comes together to try to solve the problem that's occurring to all of them. So an example of this was in the favela, there was a lot of nighttime violence, particularly in areas where there was no lighting. So they said, we got to do something about the lighting. And they managed to get the lighting. And that's been a process. And interestingly enough, the particular favela that I've been talking about is now a bricks and mortar community where the kids go to college. And I don't want to claim that ICT itself created that circumstance because it has happened to other favelas as well, but I think it was facilitated by that. And the interesting thing, though, particularly about the favela that we've been talking about, where this process sort of got unfolded and originated. It is now, if you are in the city of Fortaleza and you want to pursue your well-being and wellness, you go to this Quatrovara favela for wellness services. That's what they're famous for. So they have taken this and used it as a way to sort of build their connections. And Adalberto, I talked a little bit about the focus on the body and the movement. Adalberto would say that it's really, really important to spend time focusing on the body in addition to what we do in ICT. So they're very interested in, they do massage, they do Tai Chi type stuff. They're fully into this idea that a body is important to pay attention to as much as what's happening in your mind. So I don't want to neglect mentioning that. But the notion of collective action is actually really an important element that emerges out of the ICT, and this capacity to share suffering leads to a process of inclusion and community problem solving around an emotional challenge that people are facing. Does that help?
Yeah, so when you say we're not here to fix it, we're not here to fix a single person's problem. We're trying to find a collective solution. Is
Yes.
that okay? Okay.
Yes, and we're not here to provide a technical solution, like as a clinician. I'll get into that in just a little bit, actually, because how much time do we have?
You have about
How much? 30 minutes?
30 minutes.
Okay, yeah, so we're good.
And those that are asking questions in the chat will come back to your questions in just a bit.
Okay, let me go to the next. Okay. So I mentioned that we got involved in this during COVID, and the reason that it made sense during COVID was we could, one, do it online, and two, you could actually get relatively large numbers of people, and three, didn't have to be professionals necessarily who did it. The challenge, of course, was that we were starting from ground zero. There was, from a global mental health perspective, I've said that ICT started around 1984, right? I learned about it in 2017, even though I'm a critically interested person in this kind of stuff. That's how many years is that? That's like a long, long time to diffuse out of its Portuguese language Brazilian base to an Anglophone, right? The challenges that we have of getting ideas from other parts of the world into our own heads, I think is really, really an interesting problem. And I think it speaks not only to the way we devalue stuff from the global South, but also I think it speaks to some challenges that we have in our own culture. and what we are accessible to and what we're not accessible to. So I want to just talk about ICT in the context of America and the U.S. at this moment, and that we have I think an extreme crisis going on in our society right now, and mental health and mental health services are an element of it. Obviously, they're clearly not all that's there, and this idea of solidarity care, I think, may be a useful thing for us to start to think a little bit harder about in the context of the times we're in. So just to give it a picture, right? You all know that we've been through COVID. That's the caskets on the upper left. We've got climate change going on. We've got the ongoing racism and the issues of George Floyd. That we have also just huge economic changes, and deindustrialization is persisting. That we have outbreaks of anti-Semitism. We have the deaths of despair that have been going on, and extreme isolation and loneliness that is epidemic proportions in the United States. We have Confederates in the White House. Or in the Capitol. We have people being pulled off the streets by ICE, and we have, refugees who no longer feel like they're being given a home. Okay. And I could probably add more pictures of other challenges that we're facing, but we are being, I think, extraordinarily traumatized. And in that sense, I think we all live in the favela of 1984 that started this whole process. Now, obviously, there's a lot more that needs to be done than just do ICT, but I do think it would be helpful for us in the mental health world, in connection with the work that's going on to build and create community connections and relationships that are going to be able to deal with the cultural challenges that we have, for us to begin to think about how things like solidarity care might be implemented in a meaningful way in our communities. It's wrong direction. I don't know if you guys know, this is sort of I had kids in the 1980s, and there was a movie out then called The Never-Ending Story, which you may recall is about the great nothingness that was eating everything up that made any sense to anybody. And the kid goes into the story, and we actually have people like Maggie Thatcher saying there is no such thing as society. There is this idea that we actually don't have any relationship or connection with each other, and that we're all in some transactional game to further our individual selves. That is a huge problem as a culture and as a society, and as an economy. And what do we offer on the mental health side? Clinical care. I cannot think of anything that more privatizes and isolates emotions and challenges from society and from each other than the way we do mental health care right now. I'm a clinician to the bone. I believe 100% in taking care of people and their individual challenges. But I also see that it has been tremendously damaging in our inability to emphasize how critical it is for people to be engaged with each other, to appreciate each other, to feel solidarity with each other, to make a connection with each other. And that change, which is what ICT is an instance of, I think is something that really confronts us in the mental health world. It is a really different way to do work that we don't do. I work for years taking care of as a clinician, taking care of individuals. We tried to do groups. We were never allowed to have more than 12 people in a group if we wanted to get it funded. Had to be led by an expert clinician it had to be HIPAA, right? And by the way, I don't know if you remember this, Mary, but Then the managed care came along and said, no, no more groups. You can't even do groups. So, so I think the culture and our own mental health, our approach to mental health, have really are totally. Well, I don't want to. They're important. They're critically important for people individually, but they have missed the point for the crisis that we're in. So, issues of solidarity, of conscientization, right, which is the original thought from Freire, was how do you begin to understand as people the social circumstances that you're in and share those with each other? How can you begin to solve problems if you're not talking about them with each other and coming up with ideas about how you want to respond? And then the whole notion of emotional literacy, right? How to help people feel that they can talk about the feelings that they have and how they might deal with them. And also, I think actually valuing the concept of care, which we also don't value very much. So, what are we hoping? Our hope is that ICT, I'd love to try to figure out how to get this to the right audiences to hear it and to begin to think about what are the opportunities. We've had some foundation support earlier on to get this initiated, and we have now a very large demonstration project going on in Allentown, Pennsylvania, where we've been working. We have about 90 folks trained as facilitators, and they're working in the jails, they're working in schools, they're working in residential programs, they're working in a wide range of community settings. Interestingly, probably not totally surprisingly, particularly among the Latino population in Allentown, which has got a heavy Puerto Rican influence in the Spanish-speaking population. So we're trying to build up demonstration projects. In the United States, as you all well know, you want to do something, you have to demonstrate that it's doing something good, right? In order to do that, you have to have the resources and the funding to run a demonstration project. 44 years, no, not quite, 43 years ago, this gentleman, Phil Leaf, actually made it happen. We got something that was now disappeared, but was then called a service demonstration grant from NIAAA. And we set up a program for homeless guys who had substance use problems. And we had the money both to do the research and to provide the service. Now you have to get the money together to do the service before you can do the research, but you can't do the service until you've done the research. So the challenge with that. And that's an issue that we've been facing, just trying to get this brought before this sort of mental health world. There are other venues besides mental health that ICT applies to, community development, right? If you think about community development as not being just about bricks and mortar, but the human infrastructure, this is a useful thing to do in the context of the community. And then there's the whole world of just community organizations that are facing challenges, and that bringing this kind of capacity in doesn't have to be part of a formal mental health approach, but I think it's clearly part of an approach that would maybe informal mental health services or informal mental health supports that could be created to create the capacity for people to have community connections around their emotional lives. But that's a huge cultural change. Huge cultural change. We are now looking to support these activities, trying to find the foundations and the potential funders to just get, continue the growth that we've already got. We are looking to train people, and I'm just these are hot off the press. In Pittsburgh, I have connected up with a group called Awaken Pittsburgh, and one of the things that, following the lead that I mentioned with that Alberto had, of connecting with the sort of wellness movement, we've connected with a group that's promoting mindfulness, and it turns out that ICT as a process of helping people develop their interpersonal, their human relationships, in the context of developing their own mindfulness and their own capacities as people to do, to manage and monitor their emotional lives, that those two things together work really well. So we're trying to propagate that, and I'm just going to let you have one of these and pass it around. I just picked them up from the printer today, so they're hot. Let me see if there's anything else on the slides here. So I mentioned the indigenous roots. This is a saying that the Brazilians have. A community without solidarity is like a spider without their web or an Indian without their lamp. That's it. Thank you all. Any questions or any thoughts, concerns? Yeah.
One more question for General. Why is this therapy?
Oh, good question. Yeah. It's not therapy.
Yeah. So why is that name kept? Why is that name stayed with it?
The internet. The internet. And the reason is because in Brazil, they call it, in Portuguese, integrative community therapy. They use the word therapy. It's therapeutic. It's not therapy. And we've been working to try to eliminate that word. But the problem is if since we started with ICT, to move away from it has been a problem because we don't want people to lose the thread to get to it through the internet. But yeah, it's been a continual issue. Interestingly enough, no funder has said to us, "Oh, we'd love this idea, except why do you call it therapy?" If they said that, we'd probably say, "Okay, well, we don't care about the internet anymore. We'll take your money."
It's like calling it KFC instead of Kentucky Fried
Right.
Chicken.
So we have started to move towards like ICT because we don't want to lose the Brazilian connection and the Brazilian root, but you're absolutely right. I mean, we're saying it's not HIPAA regular. We don't want it to be HIPAA regular. We don't want somebody licensed doing this. And then they're like, well, that's not therapy. And you're like, okay, you're right. Yeah.
I'm going to take a couple of questions from online first, and then we'll come back to the room. Have you heard of this being used in homeless encampments or as part of street medicine? We used this for our staff in LA after the fires last year.
They use it? They had some connection to it? No, that's interesting.
Wendy, if you want to, I don't know if you're still on. Wendy, would you like to?
Yeah, I'm here. So it was two different. One was just a statement that we did actually use this with our staff who were not homeless, and it worked pretty well. But I was curious about, and we have street medicine programs in Southern California, and so I was curious if there was precedent for doing that.
Yeah, basically the favelas are homeless people. So historically in Brazil, it's been used with people who are living essentially on the street in a cardboard box. In the United States, it has not been used. But I mentioned the group when I started out talking about the group in Switzerland that we found on the internet at the bottom of the internet. They've been doing work with homeless folks without housing in Switzerland and Geneva for decades now. So yes, and in fact, you can look for it. It's called Life Raft, the Geneva Life Raft, and they run an ICT as a demonstration every second Tuesday of the month at 11:30 Eastern Standard Time. That you can join. Anybody can join, and you can see what an ICT is like online. This Life Raft in Geneva.
Community conversations now as of a year ago.
What is it called?
Community Conversations,
Yeah.
formerly known as Geneva Life Round.
Yeah. Okay. So they changed the name. Yeah. So it's there. What's it? Maybe we should say that loudly so people can hear it if they want to.
Raft Community Conversations.
Raft Community Conversations. If you Google that, you can tie into some of the work that's going on in Geneva. And it's specifically around folks who are undomiciled.
And then the other question is, how can you raise awareness in American communities that make the concept accessible?
Your lips to God's ears on that one. We right now, so what's fascinating to me in this culture is that we have this incredible, you've got Vivek Murthy, the former Surgeon General, talking about the epidemic of isolation and social disconnection. You have, oh boy, what's the New York Times columnist he's just got to you, David Brooks. David Brooks talking about the society that's disconnected from each other. I mean, it's like everywhere that people are acknowledging that we are not linking and connected with each other. And there are a lot of initiatives to address it. Most of them are about somehow using AI intelligently, which seems like the absolute opposite of what I'm trying to propose here. So on one level, I feel like we're swimming against a very strongly financed current. I feel about this a little bit like I do about peer support and mental health. I just wish I had I have seen in the clinical work that I do, I have seen peer support be extraordinarily important to people finding a way to make a life for themselves. And if I had the budget that some of the companies do that are manufacturing and selling a wide variety of pharmaceuticals, to just sell the idea of peer support, if I could, take a picture of a doctor who has, the current ones are usually, I prescribe this medicine for the patient and I'm very happy about it and the patient's smiling over here. If I could do that with a peer support and have the money to, have a doc say, I recommended peer support, have the peer guy smiling and the peer recipient smiling, and we could spend the money to do that, I would be very happy. Unfortunately, I think we have to figure out how to spread this by word of mouth through human networks and frameworks that are built around how we as a community are actually finding ways meaningfully to connect with each other. And somehow we have to find a way to culture jam the circumstances that we're currently in. And I'm one of the reasons I'm coming to talk to you is because you guys are all at the premier mental health program, global mental health in the United States, if not the world. And the roots out from all of you into the communities, maybe there's some ways to start building out of some of the work that you're doing. One of the reasons I was very excited to come talk with you all, but I'm also really interested in hearing your critiques or your concerns or your other thoughts or expansions on what we're doing. So I don't expect you to do my work for me necessarily. Yeah, I hope that answers at least a little bit of your question. I'm writing all the time to these folks and saying, look, we've got this method that actually has people talking to each other and it's not AI. Yeah.
That was really helpful. Thanks, Dr. Thompson.
Thank you.
Yeah, so thank you for the presentation. I was one of those people that joined this on Zoom during COVID to learn what it was like.
Yes, I remember.
Yes, with my Pacific Northwest friends. So that was an interesting experience. The thought that comes to my mind when you describe this is it reminds me of 12-step programs, right? Because they are community gatherings.
Mm-hmm.
They are meant to be facilitated by lay people.
Mm-hmm.
They don't have a people come and they bring their problems, and there's, I mean, I guess 12-step is different than it has service involved, right? There's a stricter, maybe there's, I don't know if it's stricter, but there's a set of rules, right, that go with 12-step programs.
Oh, well, there are the 12 steps.
The 12 steps, exactly. But even the way that people, what is the role of people who are conducting meetings, people that are
Right, they have an infrastructure.
I mean,
They have an infrastructure which we could copy in some form or fashion. And I mean, it's taken what's 80 years for 12 step to actually, get beyond Dr. Bob and to grow it out.
but it's become, I mean,
But it's there.
for everything, right?
There's a whole culture of this.
Exactly.
Yeah, so the interesting so I absolutely, this is really, and I think that 12 steps and any meeting that gets people together to share challenges is a tremendously good thing, right? Or can be. There are areas where it can go wrong, and we have to think about that as well. But so the difference with this between the 12 step is, one, anonymity. So we're not expecting anonymity. And that 12 step has a very specific focus on the addictions, right? There have been some efforts to grow out a mental health. There's Recovery Incorporated, which was a small groups for people with psychiatric challenges that actually started in the 1930s. Has never been able to really take off, but exists out there. This, I think an infrastructure, a societal infrastructure that promoted mutual aid groups that address people's emotional lives in some form or fashion that extended beyond the 12 steps is kind of the direction that we're talking about. Yeah, so you don't have to have, the ticket is not that you have a specific, quotes, pathology. The ticket is you're a human being and you've got challenges in your life. And the community you're in has challenges in it that you have to live with and deal with.
Thank you for this. This has been very, very interesting because it tackles on something that I'm also trying to work through, which is this idea of how do we learn from global South insights and how we apply them here locally, right? And one thing that I'm struggling with currently is that kind of like the cultural adaptation of the theory of change of an intervention, right? Because an intervention like this makes total sense in Latin America. It's so much so that the health system will take it in, right? But I'm wondering if, yes, the peer support and the new connections are important, but I'm wondering what do we do with the Freirean, like the conscientization, collective action part of it, which is part of the task theory of change of the intervention, whether that applies here and under what conditions and what outcomes we measure or propose in this current famine secret scenario, right? So I'm kind of like trying to work through how do we kind of like adapt without losing the key ingredients.
Yeah. The hardest part, and I think one of the barriers to collective action in the United States and Anglophone countries in general, is this emotional rigidity in groups. It's just really hard for people to feel safe enough to talk and share themselves. Once they do it, people overcome it. It's to get them in the room in the first place. That's the hardest part. My own impression is that the collectiveness, the solidarity part, is actually built when people are able to share their emotions with each other. That it's harder for people to work collectively together when they are emotionally reserved and kind of disconnecting from each other. They just don't. It doesn't. So I think that's been an impediment in this particular culture. And when it breaks down, when that reserve breaks down, then it functions. It's not like we have never had collective action in the United States, right? And certainly some communities have been more open to it, and some communities have been forced to be more open to it because the challenges that they're facing are so much greater. You've got to figure out a way to work collectively, or you'll be crushed. My hope is that we figure out how to get enough people, grow it bit by bit, enough people that they can bring the margins in, and people start to experience some of this capacity to be in connection with other people in a way that they've really never experienced before. I mean, I before ICT, how many large groups was I in? Now, I will say we also have historically had some experience with this. There were groups done in the 1970s, Esalen and what do they call it? Earhart, got a block on his name. Est groups, right? And we've had some cultish type of behaviors around groups that have made us a little bit more nervous about this kind of work, which is one of the reasons that it has to be done in a way that's really diffused and doesn't collectivize it in a central person or central place. And that's another impediment to it, because in the United States, we really like our charismatic leaders to tell us what to do. And that would absolutely be the wrong way for this to grow. This has to be about people finding a way to connect and communicate with each other about issues that they have. And then I think the collective solution part emerges once you start to have people being in connection.
And I share your distress about what's going on in our world. And I hear you speaking about the impediments to kind of expanding this, but at the same time, I could view this as a period of opportunity because people are so distrustful of our systems. So I think that there are opportunities, especially I think people who are work with immigrant communities. They couldn't need it more than they do right now.
Absolutely. So I think the stress is there. The question is, can we get the resources and the capacity to help people address it? You do have another question.
Faith-based community. When it's been done in places and potentially here. Faith-based community.
So it is. I keep mentioning the church courtyard, right? Because they don't have basements in Brazil, but here at church basements, yeah, absolutely. We thought we had a great in with Trinity Church in New York, which is the big Episcopalian church downtown. And then they decided to reorient themselves just as we were about to come to terms with them on a process to get the religious communities engaged. We just need the doorway. Just need to find the right door. I haven't found it yet. But I have actually, that's a really good prompt and I mentioned already the importance of synchronicity and sort of this. Just today, as I was coming here, there were folks talking about a faith-based response to it was something more specific than what has been going on with ICE. But one of the people is at the Presbyterian Seminary that's just a mile from my house. So you've now painted an arrow towards them.
Letitia, do you want to ask your question?
Yeah, so I want to kind of bring it back to what you were saying, Pamela, about the 12 steps and how you were saying that it's very diagnosis based or very culture based or faith based. There's a lot of groups that do that and do a very similar situation, but there's a time factor. So people can't go to all groups. And so, yes, you have these little groups in these little sections, but they don't have time to go to all of them. And what I found by going to each one of these little groups that is set up very similar to this is that a lot of them have the same issues. But for them all to see that they have the same issues, they don't have the time to be there. So what you're proposing is everybody being in solidarity and listening to everybody. That takes time. And a lot of people, in my experience, what I've seen is that a lot of people just don't have the time for that. So to find those collective solutions is hard. So what would you suggest to kind of eliminate that time? Like, because you have, your 12-step or your faith-based, they all have different issues, but it's collective, the underlying issues. I don't know if that made any sense. Sorry.
Yeah, well, I think we live in a world that is very demanding and people are pulled in many directions. And it may be that not only are people find it challenging to be in groups together where they talk about themselves. Um, Interestingly, I should just mention this as a cultural side. When we do these groups with Americans, it is extremely, I don't want to say it's extremely difficult, but it's a bit of a challenge to get people to actually talk about themselves. So people often will say, you know how you have a problem in your life and you feel like somebody's doing something to you, and you're sitting there saying, actually, use the word I. Try to use the word I. And we have a hard time. I have a hard time doing that. So I think that people are participating in groups in all kinds of ways, but they're not getting to the emotional issues that are involved in that group or in their own lives in those conversations. And what I guess I would imagine in this network of all these different groups that people participate in, that somewhere in there is a group that allows them to talk about the emotional challenges that they face on a day-to-day basis with people who are there to share their own challenges and what they've done to overcome them. And that in that process, they develop linkages with that particular group of people, but also begin to develop the capacity to be in these smaller groups that you or other groups that you've mentioned, and be in a better place to talk about some of the emotional issues that they're facing. Because I think that at least in my experience, personal experience, participating in a lot of groups, when people are not talking about the emotions that they're having in their own lives, the groups don't work very well often. They kind of blow up, and people don't know why. So I think that in some ways, and this may sound like a cop out in some ways, if people were able to be more emotionally set and connected in groups, the groups would be more effective in the work that they did and would be more efficient in carrying out what needs to be done at the collective level. Does that make any sense to you?
Yeah, yeah.
I mean, it's the best answer I have. So you're kind of stuck anyhow, aren't you?
All right, we're gonna give Jeff one last question online and then come back to the room and then close out. So Jeff, go ahead.
Thank you so much. I believe just hearing a lot of the conversation, I think one aspect that keeps coming to my mind is the aspect of vulnerability, and that the fact that there are vulnerabilities so that people are sharing their struggles, sharing their difficulties, sharing their challenges inside their life. So that's what make others, I guess, in the room know and feel that we are all human beings. There's a universal struggle that we are going through, therefore fostering a sense of collectivism and a sense of community. I'm wondering, what does that look like within like the US context, since that seems to be a very different challenge depending on the culture and depending on how the culture even interpret or exhibit vulnerability.
Yeah, absolutely. Very good question. The vulnerability, to be vulnerable in the United States, obviously that changes depending on which culture and what part of that culture you occupy. So you would not necessarily, just to be maybe overgeneralize here, but you would not expect men to start being incredibly vulnerable in groups right away. That takes a little bit of time for people to feel secure, and for men often to reveal their vulnerabilities in the culture that we live in. What's interesting is that we find that one, that men will do that in these groups when in the context of the setup that I've mentioned, and the idea that we want to convey to folks is, and this seems to help some people in the United States talk about their vulnerabilities. When you give your vulnerability to the group to work on, it actually helps the entire group. So it is kind of a service. I mentioned that a metaphor that might be helpful with this is, I mentioned Muhammad Ali's comment about the pebble, right? Well, it turns out if the group works on the pebble, it becomes a pearl, right? It becomes a pearl of wisdom. And at the end of the group, there is an appreciation for the sharing of the pebble that became a pearl because of the gift that is. So you turn a vulnerability from being an admission of some weakness to a thing that is now a gift to the community and a value to the community. So it's less of a vulnerability and more of a community-owned gift, if that makes sense. It is really quite striking at the end of one of these sessions, and you've heard the capacity for human beings, any of us, to show and demonstrate a kind of wisdom and an awareness of the humanity that you mentioned, that people walk away from these groups touched in some way that you do not ordinarily imagine happening in interactions between people in a room. If that makes any sense to you, Jeff.
Yes, it does. Thank you so much, Dr. Thompson.
Sure.
So I have a question that's a little bit unformed, but you, at the beginning, you talked about that Alberto Barreto realized that he could organize the capacity of a community to care for themselves. And I'm just wondering about what that looks like before, what determines whether a community has the capacity to organize themselves to care for each other. And is it, it happens in faith-based organizations, right? It happens in that is what happens in many parts of community. But what is it about, I guess, the organizing, right? Organizing care is what kind of strikes me as an interesting question. And one of how do we exploit the many opportunities for that?
Right.
This being one of them. But yeah. And how much do communities have? Right. I mean, it's a great question. I mean, it's a great idea, but I'm very intrigued by it.
So Adalberto has this happen in a favela. He has this realization. And my projection, right, my imagination is that, boy, did he get lucky it was a favela. Because in the favela, there was both desperate need, as you've already heard. People are cheek to jowl anyhow. The idea of being in a kind of connection and community, maybe not such a strange idea, but still not organized.
Yeah.
So what I understand Adalberto did was, with leaders of the favela, they just sat down and said, okay, how can we as a group come up with a process that will help people be together in a way that allows them to, as a group, focus on the challenges that we are all facing on a day-to-day basis. So Adalberto is very clear about this. He facilitated that question and that growth, but it was the leaders of the community and the community itself that actually gave shape and form to what ICT has become. So they're creators of this as much as he is. For the United States, in our culture, I think I'm going to use the word neoliberalism, but I could also use individualism. I could also use greed. That we have created a society that has so focused on our own individual attainments that we don't really know how to think in the way that you're suggesting, except in some of these institutional vestiges that are luckily have survived or are still here, the faith communities. I, not being a member of a faith community, I don't like to think of myself as being faithless. So the faith community that isn't in a faith community, if we can find those folks, how we build that organizational capacity that's actually the big challenge that I see right now. That's, if we can figure that out, then we'll get the facilitators, we'll find the communities. But we've got to have a way to think about how to make it known that the organization of how we connect and relate to each other is really critical.
And it would be very interesting to look at the other ones that do happen, either organically or institutionally, see how many of these qualities do they have. Are these places where people are emotionally vulnerable? Are they, you know what I mean? Are there a set of qualities that help us organize communities to care for each other? You know what I mean?
Yeah. I mean, we know that the 12-step does.
Yes, that does.
Right. The 12 steps do that, but for only a very particular group of people with a particular issue. So in some ways, it really is about generalizing that in some way. Yeah.
Think back to my undergraduate sociology days, but I think back to this idea of what you were talking about of sort of champions and leaders and people who are willing to sort of take a chance at the beginning and then bring others in. And so a couple of years ago, before this latest round of the Russian war, in between Russian wars, we've been working in Ukraine. And we were doing mental health services, and we had a lot of people who wouldn't come. So we started being like, well, how do we introduce mental health? How do we introduce the comfort of talking about mental health? How do you get people to even have a vocabulary and feel like this is something that's relevant to them? Like these early things and not so scary and not like, oh, therapy. And so we started working, we started working with sort of single session introductions at the gym.
Yeah.
And people would come and guys would come, and we wouldn't call it mental health and we wouldn't call it community building. We'd call it like, hey, you got stress.
Right.
And giving people, and then they'd start telling their friends, and then they'd start telling their friends. And then some of them would then come be like, okay, I'll try the group conversation. And then once those got going, it's almost like once it got comfortable and once there were a few guys who did it, then we could institutionalize it. But I guess as it relates to the ICT, I guess my question is, and it sort of gets to what Pamela was saying, which is, it's almost like in our society, where isn't the favela, it isn't rural communities where everybody knows each other, it isn't that sort of early stages of comfort. It's almost like you need an inroad stage to give people the opportunity to learn about each other. Before you start talking about pebbles, there needs to be
just a little bit of introduction, just so there's some sense that they know each other. Yes.
And so one could imagine. So I guess my question is, does ICT have a ramp up before you, like, are there multiple sessions in terms of a ramp up before you get into the sort of the meaty weekly pebble sharing?
So, yeah.
And is that the adaptations that we need for contexts where it isn't as collective or it isn't as comfortable yet to get, is that the adaptation, is the on?
So a couple things. One is, actually, there's been a lot of ICT work done in Ukraine. And particularly with the refugees. And I actually went and did a consultation in Poland to do some stuff with the refugees, and then the political world completely changed. So, but there is a ramp up in two ways, I think. One of them is, you want facilitators who are linked into and part of communities, who can sell the idea and who can figure out how to bring the people into some kind of relationship and connection. We initially started training people just when we started doing facilitated training. We'd get anybody who was interested, and that was good. People liked it, but they didn't know how to use it because they couldn't bring it into a group. So we've now gone to, and what's actually worked in Allentown, in Bethlehem, is to work with people who are facilitators who have a community that they're already tied into in some form or fashion. So that's helped. And then the other thing is, it is for Americans aggressive to go to the pebble right away, right? Much better to go to some overall theme, like, the weather has been really difficult. How are you coping with it, right? And how are you getting to places you need to get or you can't get to? How do you manage those? So stuff that is not doesn't require you to reveal anything yet about your vulnerabilities. Once people do that, I think it then becomes a little easier to imagine how your theme or your personal issue can be a theme that isn't specifically about your problem, but is about a larger problem that we all share. And people tend to become a little easier to participate. But it's getting them in the room in the first place that's the biggest challenge. And then getting facilitators who are in a place to get people into the room, next challenge. And then the challenge that Pamela was identifying, which is, what is it that gets a community to think it needs to organize itself around caring? That's really the hardest part right now for our society, because we do not have a society that organizes itself around caring unless you can make a lot of money doing it.
Or unless you have a key problem that you said, like unless there is something that is in the face.
Right. Or you have gender roles that require, the women must be taking care of all the people who are dependent. Right. And those are not, that is not a structure of caring. That's unfortunately it's an exploitation of caring. All right.
Thank you very much.
Thank you guys. It's a great question. Thank you all.